really excited about the Healthcare Experience Design Conference. We're bringing together the best and the brightest to talk about design in the healthcare space and how to make things better. It'd be impossible for me to describe the mixture of euphoria, adrenaline, pride, and gratitude I'm feeling right now. Back in 2010, I got into a conversation with a colleague about healthcare. You know, one of those conversations where everyone ends up throwing up their hands and saying, "This thing is such a mess." I didn't want our conversation to end. I wanted to keep talking about design in healthcare.
Statistics were shocking, and I think it was good. It was one of those, it was shocking enough as well as with an emotional story behind it that is enough to be a catalyst to cause some change. So I really appreciate that.
As a father of four, I can relate to all the anecdotal stories about the state of healthcare and food here in the U.S. So it was a great kickoff and a great start to the morning.
I like when talks are, nice and quick, so you can learn a lot of different things from different people. So
we had a fax machine for a really long time that was as good as technology got, and we created something better. And I think that opportunity is now in front of us. We've kind of had Healthcare 2.0. Let's redesign it. Let's introduce Healthcare 3.0, 4.0, 5.0. Where can we take this? How can we integrate this into our healthcare system?
So we're discussing trends in mobile, social, behavior change, improving the quality of experience clinicians have, as well as the end consumer. And we're also looking at how the food system and the healthcare system are interconnected and how both of them are broken. But since you are what you eat, let's all, I guess, try not to get sick to begin with by eating healthier food is the theme of many of our speakers today.
Since I knew there would be a decent amount of people who work in health and design at this event, I wanted to empower them to make them understand that don't settle for just pretty, that you could go far deeper than that. You literally have to put yourself in the place of a patient and grasp their life, completely absorb it, and then start designing from that view.
I feel it went pretty well. The audience seemed to be pretty engaged. They asked a lot of good questions. I got a lot of feedback, and I think it was a really great way to meet a lot of people who are working on healthcare design from basically every end of the spectrum.
Well, I first got involved in the conference because I saw it and I thought it looked really interesting, and then found out that we were sponsoring as well, so I came down and was helping out with the booth, and I'm also going to see some of the different speakers. So
they've done a great job putting this together. Organization is perfect. It's a great venue, so we're very happy to be here.
The amount of people I've been able to meet, some of the talks are incredibly relevant for us, and just connecting with the speakers and connecting with the attendees is invaluable, basically.
I came out of it thinking I could use this kind of in personas that we did. So really kind of looking at kind of realistic data.
I was able to take notes on incredibly concrete items that I can go back tomorrow and start to apply to projects that I'm working on. That's really what I wanted to get out of today, and I got it in a variety of ways through a number of sessions, so I was pleased with it overall.
I think there's a lot of great messaging here and a lot of great energy and information and empathy, really, for folks in the healthcare space and the people that we're here to work for, the patients and the people who are looking to change their behaviors and lead healthier lives.
But getting everybody together is sort of in a way to talk about it, makes it a little bit easier to sort of bring down the walls and allow for those sort of problem solving to happen in a more natural way.
Each of us received a piece of sand that will irritate and disrupt and hopefully generate a pearl. Some of the things we're hearing today are upsetting even about the food system, but I think that designers are catalysts for change, and I think that we need to hear the hard facts and data so that we can work it into our life's work and hopefully make things better.
Finally, there are other people that think like me. I didn't know they were out there. And it must be like the 200 or 300 people in the country. We're all right here, right now. Everyone else who thinks like this, either they couldn't make it or they don't exist. We're all right here.